Hello, my name is Kate Wyatt. I'm a quality improvement nurse for care homes for South and North Norfolk CCG, and this is a training video for the use of iStumble for care providers. iStumble is an easy to use algorithm that was developed by the West Midlands Ambulance Service to help care staff safely and effectively identify if they're able to pick up a resident who's fallen over. We're going to go through iStumble step by step so you have a clearer understanding of how to use it, and then there is a live demonstration done in one of our care homes showing a live run through of the algorithm in action at the end of the film. So to start off with, when someone falls over, remember your basic principles of first aid. It's really important that you run through your ABCD assessment first to establish that there are no life-threatening injuries which need immediate action. These are airway. Is the airway open? Is the person breathing? And is there any active bleeding that you need to stem immediately? Always make sure it's safe to approach the resident and you are not going to hurt yourself, otherwise there will be 2 casualties. If you're able to run through your ABCD and establish there's no immediate life-threatening injuries that need attention, you can move on to using iStumble. The I in iStumble stands for intense pain. Is there new intense pain since the fall? This could be head pain, it could be neck pain, but remember it could also be pain from a medical cause, not just an injury. It may be that the person has had a heart attack and has chest pain and this has caused them to fall. It could be they have severe abdominal pain because they have some bleeding inside, which again has caused a fall. Alternatively, they may have sustained an injury when they fell. It's important to distinguish between normal pain for the person and new pain. It may be that you will need to reassure them for a few minutes, allay any anxiety that they have, and then reassess to see if the pain is in fact just an exacerbation of their normal pain that has been increased by the fall, or whether it is indeed new pain. If they have new intense pain, then you need to phone 999.
There's no pain in your head or your neck or your back?
No, because you're giving me a bit of...
Yeah, sure.
Yeah.
S stands for suspected collapse. If the resident is able, ask them if they remember any trips or stumbles before they fell over. See if they felt faint or if they had any nausea or headache before they fell. This may be a clue as to what happened. Don't worry if the resident can't remember, but it's helpful if there is a trigger that they can identify.
Falling?
What can I say? Well, you fall and you're down, aren't you? Yeah. I was frightened.
But you remember falling?
I do, yeah.
T stands for trauma, especially to the head, back or neck. Have they got any new dents or bumps on their head, especially if that's associated with bleeding? Can you see any obvious injury?
I'm just going to grab the manga out and then we're going to get you up, Jim.
Yeah.
Can I just feel your head, darling? There's no bumps. Right.
Have they got any new numbness or paralysis in their face or any of their limbs since the fall? If this is the case, again, phone 999.
No lumps or bumps. There's no numbness anywhere?
Well, I can't feel anything like that at the
You can feel all
moment.
your legs and your arms?
Yeah, they're all right.
Yeah.
They're all right.
U stands for unusual behaviour. You know your resident well, you understand what's normal behaviour for them. Even if they're unable to tell you that they feel different, you may identify that there is new behaviours which are unusual for the resident. They may be acting differently to their normal self. For instance, they may be combative or aggressive when normally they are very quiet and peaceful. They may have differences to their speech in that it's slurred, or they may have difficulty in finding their words. If this is normal for the resident, that's okay, but if it's new, you need to report it and make that 999 call. M stands for marked difficulty in breathing with or without chest pain. Is the person severely short of breath? This may be due to anxiety, so spend a few minutes trying to reassure the person and making sure that any anxiety they feel is reducing, and then reassess their breathing. If they are still severely short of breath and this is not normal for your resident, you need to make that call. Are they able to complete a full sentence? If they are so breathless that this cannot happen and they are normally able to do a full sentence without any problems, this is what we call a red flag and needs to be acted upon. Do they have blue lips or fingers? Are they increasingly agitated or confused? This may indicate that they have a reduced amount of oxygen going to their brain and is often a result of severe shortness of breath. Again, you need to act on this. Do they have new onset of being unable to breathe when immobile or laying flat? If this is the case, then you need to phone 999. B stands for bleeding freely. Is there fast flowing, squirting or pumping blood coming from an open wound? Is there any extensive swelling or lumps appearing around an injury? If you can, control the bleeding by applying direct pressure. When you make the emergency call, if your resident does have free-flowing bleeding or a large amount of swelling or bruising around an injury, you may be asked to estimate the amount of blood loss in mugfuls. This can be very difficult, but it helps the call handler estimate the severity of the call and the response that they are going to give you. L stands for loss of consciousness. Has the person been knocked out? Are they drifting in and out of consciousness and this is new for them? Have they difficulty in remembering what happened? Do they also have difficulty in retaining information that you are giving them? Again, if this is not normal for the person, then it's a 999 call. Remember, everybody is different and you will often be looking after people who have cognitive impairment, so you understand what is normal for the person. We are looking for things that are not normal for this person and that are new since the fall. E stands for evidence of fracture. Is there obvious deformity in any bone? This could be in the form of a lump, a visible bone, or extensive swelling in the area. Is there a reduced range of movement in any limb or part of their body? This can sometimes be hard to identify with someone who has cognitive impairment, as they may not recognise their pain signals anymore. However, you may spot something if they try and move and are unable to do so normally. At all times, be aware that you should retain your ABCD in the forefront of your mind, and if you see any deterioration in the resident that threatens their airway, stop using I stumble and make an emergency call. If you've gone through I stumble, it's always worth checking for signs of a stroke. Use the FAST formula, so face, arms, slurred speech, time to call. If you've gone through I stumble and your resident is uninjured, it's safe to move them. During the time it takes you to go and get the equipment, someone must stay with the resident. It's also prudent to reassess the person using I stumble just before you lift them from the floor or the surface they're on. When you're selecting lifting equipment that's appropriate to the resident, this may be of various types. It may be that the resident is able to get themselves off the floor with some supervision or minimal assistance from yourselves. However, it may be that you need to use a manga elk, a razor chair, a stand aid or a hoist. This should be assessed by yourselves as the most appropriate method of lifting for that resident in those circumstances. In the live demonstration done by one of our care homes, you will see that they've used a manga elk to lift the resident from the floor.
Help! Help! Help!
Oh, Jean, are you alright, darling?
Help! Oh, help!
Alright, darling. That's alright. I've just pressed the emergency, darling, alright?
Yeah.
Are you alright, sweetheart?
Yeah, I'm alright. Oh, I think I am. Did I get up?
Does anything hurt, darling?
You okay? What's happening?
Can you
No,
grab the...
just a lump in the
Yeah, we'll
bottle.
take it. We'll take it.
So we're just going to grab the manga elk and then we're going to get you up, Jean. Can I just feel your head, darling? There's no bumps. Right.
Do
You
we
just
get a
stay
bit?
there for a second. Right,
Yeah,
just stay
okay,
there.
yeah.
Right, just got to ask you a few questions, Jean.
Hold on. Yeah.
Have you got any new pain since your fall?
Well, not at the moment till I get up, Heather.
No, okay. Have you got any headaches, chest pains or abdominal pain?
No, not at the moment. I'll feel them when I get up.
Do you remember falling?
What can I say? Well, you fall and you're down, aren't you? Yeah, I was frightened.
But you remember falling?
I do, yeah.
Was there any dizziness or feeling sick before you fell?
I don't think so. I can't remember that, but I don't think so. Yeah.
You didn't faint at all?
Well, I don't know, you see. I just started to come out of the toilet and I've been staring.
There's no pain in your head or your neck or
No.
your back?
No, because you're giving me a
No.
pillar.
Yeah, you
Yeah.
sure?
Yeah.
Right, I'll just feel your head again. I couldn't feel any lumps. No, no lumps
That's
or
all right.
bumps. There's no numbness anywhere?
Well, I can't feel anything
No,
like that at the
you can feel all
moment.
your legs and your arms?
Yeah, they're all right.
Yeah.
Yeah, they're all right.
So I'm just going through the behaviour part, Jean, so you're not any more confused than normal.
No. I won't be on my own, would it?
No, and you feel your normal self?
I do now. Yeah.
There's no shortness of breath?
Not that I can think of. No. That happened so quickly.
Yeah, of course, I'm sorry, we'll get you up as soon as we can. Well, I can't see any blood, Jean.
But I have some bruises, I expect some.
Yeah, I know there's no blood from your head.
I just lost my balance and went down on the bum.
And nowhere hurts still?
Not at the moment.
No.
No, not at the moment.
So you weren't knocked out or anything, you didn't hit your head?
No.
No. And you remember everything that happened?
Well, I came out there and I was just down, weren't I?
Yeah. Can you just straighten this leg up, Jean, so I can just check it's not
Yeah, of
longer
course you
than
can.
the other?
Yeah, that's all right. Yeah.
No. And can you straighten both your arms out? Brilliant, thank you, Jean. And you've got no reduced movement in any of your limbs?
I don't think so.
No.
I shall now tell you more when I get up, I expect.
Of course. Right, so I'm happy, Jean. Are you happy? Yeah?
Yeah, I think so.
So what we're going to do, Jean, is we're going to get you up now. All right?
All right. Yeah.
So, Jean, do you think you can sit up for me? There's no pain in your back, darling.
No, I can't see him.
What we're going to do, Jean, is we're going to slide this underneath you.
What does that do then?
So this will help us get you to a height that we can stand you up.
Oh.
Right, so Jean, can you just lift?
Lift the bottom up and
Yeah.
lay on there?
Well, if you roll to me, just like that's it.
Oh, you put it underneath.
Yeah.
Yeah. Can I just lift the bottom up?
There we go. And then if you roll the other way, my darling.
Yeah.
Come to me.
There we go, Jean. That's brilliant.
Is that all right?
Yeah, do you want to sit back up, darling?
Do we sit?
Yeah.
Okay.
And I'll kick my shoes off.
And there's no new pain since we've moved you?
No.
No?
No.
Brilliant.
Right, it's going to be quite noisy, Jean.
So what we're going to do is if we just grab your frame, Jean, so we can have that in front of you. So I'll put this in front of you, Jean.
Yes.
So what I'm going to do, Jean, is I'm going to stand behind you and counteract your balance. Alright?
Okay, it's going to be quite noisy. Okay, we're going to start.
Have I got to get up?
No,
Not yet.
you just
You'll
stay
see what
put.
happens in a minute.
Stay put.
Yeah,
With
stay
there
there.
in front of
So
me.
you leave your frame for a sec and just put your hands on your lap.
Oh, I've got to blow up, see?
Yeah. keep Jean, just keep your hands in the middle, darling, and I'll counteract your balance.
Lovely, thank you. I've got a faces because
Are you okay, Jean?
yes, I'm fine, thank you. It's an experience, thank you.
stand up, you hold onto your frame and stand yourself up. Are you okay now, Jean? Are you alright, darling?
Yeah, I'm fine.
Yeah?
I'm fine, yeah.
Pop a chair behind you, Jean, and you can sit down, darling, for a minute. Alright, darling?
Yeah, I'm fine. Yeah.
We would like to thank everybody involved in the production of this video, especially the staff at the beaches and Jean.